Hi, I'm Dorothy Shaw, the Vice President of BC Women's Hospital, the former President of the International Federation of Obstetricians and Gynecologists, and the inaugural Chair of the Canadian Network for Maternal Newborn Child Health. I'm a committed advocate for women's health globally. BC Women's Hospital is dedicated to improving the health of women across Canada and indeed across the globe. We work towards this through diverse training opportunities, global partnerships, and international research initiatives. 3 such projects are Astrid Christofferson Deb's Chama Mama Toto program in Kenya, which provides community-led peer support for women in pregnancy and postpartum. Peter von Dadelson's Preempt initiative, which developed, tested, and implemented new knowledge and interventions to reduce the burden of hypertensive disorders of pregnancy globally, one of the major killers of pregnant women. And Gina Ogilvy's Aspire project, which is implementing culturally appropriate, scalable, and affordable cervical cancer screening in Uganda. Each of these initiatives contribute significantly to the improvement of women's health and rights globally. And we have several examples of how our research globally has actually helped women in BC through reverse innovation. And I anticipate that at least one of these projects is going to do the same.
Somo ka afya kusomyange ba mama bano mahwaka kabuhane mahwaka family planning mahwaka immunization mahwaka breastfeeding kunonya bana mahwaka chaka clinic hare Uluchimborula la mama bano bachako bamusyama buno uluchimbo inamba ichire ongeza kamuno yaba mama bari kuchanga musibitali ano kunyola kudumecho.
It is estimated that every day about 830 women die due to preventable complications of pregnancy and childbirth. However, these deaths disproportionately affect women living in the poorest parts of the world. Of these 830 daily maternal deaths, more than half take place in sub-Saharan Africa and over a quarter in Southern Asia, compared to less than 10 in developed regions. What makes this loss of life unacceptable is the fact that most of these deaths are preventable and are caused by delays in identification of disease, delays in transport to an appropriate health facility, and delays in receiving life-saving treatment. Furthermore, for every 1 woman that dies, there are at least 8 others who suffer from life-altering complications. The CLIP trials comprise 4 independently powered randomized control trials and were conducted in 4 different countries: Nigeria, Mozambique, Pakistan, and India. Countries that, when combined, account for more than half of the global maternal deaths. By training community health workers to provide enhanced antenatal and postnatal care in women's homes, the CLIP intervention aimed to reduce the delays in triage and treatment of pregnancy hypertension and its related disorders. Task sharing clinical roles for lay health workers was achieved by implementing innovative solutions, such as a low-cost validated blood pressure device, a pulse oximeter, and a mobile health platform fitted with a validated risk assessment tool. Furthermore, our facility assessment prior to the trial informed us of the social barriers and cultural beliefs about seeking care. In Nigeria, for instance, strong cultural belief warranted a visit to the church before the hospital. Communities were engaged in order to identify and address barriers in responding to obstetric emergencies. Through the CLIP trials, we have learned that saving the lives of mothers and babies cannot be achieved without strengthening primary care and building resilience in communities.
What I tell people that Aspire is about is an option for HPV self-collection in low-resource settings, specifically in Uganda, where women don't have access to screening, partly because there's no infrastructure in the country for a cytology or a pap smear-based screening.
New screening technologies are very welcome to a developing country like Uganda.
We went house to house looking for women above 30 years. And I was given that swab and I tested myself.
So if you have this simple test, It doesn't really need highly trained people to run it.
Even if you looked at training someone that can read a pap smear, this may take 2 years. Our lab technician, within 2 weeks, they were thorough.
We know that HPV self-collection is a feasible way to screen for cervical cancer. We know that from studies that have been done in hard-to-reach women and in low-resource settings. But many of those studies look at women who come to a health clinic and then they do their own self-collection there. And so there's few projects that actually focus on women collecting their own specimens just in their house. And so I think that in the way that it is taking down all these systemic barriers for a woman accessing this screening, that's what sets Aspire apart from other approaches to cervical cancer screening.
When people receive good service, they become change agents in the society.
So when a mother lives and can tell the story, what it will do is beyond our imagination now.
Since most of our economic development is supported by women, there are benefits to the family, there are benefits to the community, and there are also benefits to the nation.
There's no question that women are willing to participate. The technology is there to do it. It almost sounds too good to be true, but it is actually a feasible method to move forward with.
If there's a big project, I'm ready, ever ready.
In 2015, the Millennium Development Goals came to an end, and one of the Millennium Development Goals was about maternal mortality. We did not hit the target of 75% reduction in maternal mortality, nor did we hit the target in terms of child health and child mortality, because the most mortality in terms of children under 5 relates to the newborn period. So it's all related to the health of the mother and the time around birth and delivery, which is the highest risk time. So we still have a great deal of work to do. In low and middle income countries, in fragile settings, and even in some high income settings. It's also very sobering that although we go out of our way to provide the best care possible at BC Women's to women during pregnancy, labor and delivery, and afterwards, that 53 million women around the world receive no pregnancy care at all.